After your procedure that you received at our various pain clinics, you will receive a script in theatre. Today we're going to talk a little bit about what to expect and what pain management we do post-procedural. If you received your facet-blocks, you will get a script of basic paracetamol or Panado, which is a pain block, and your doctor will tailor-made it according to every patient's needs. Some patients will receive an anti-inflammatory and some of you will receive a muscle relaxant. The idea of our post-op pain management is only to take the medication as needed. In theatre, we inject you with local steroids and also local anesthesia, which will give you temporary pain relief, as explained to you before the procedure. Corticosteroids work short. Afrikaans, we could say that corticosteroïden werk kort. It didn't last that long. And your follow-up schedules are only scheduled at week 1, week 3. So in that window, you might experience pain. So that's why we would like you to have some pain tablets at hand, which you can take. We usually recommend to start with paracetamol, as that is our first line of treatment in the WHO stepwise pain approach. If the paracetamol do not give you relief, and if you do take paracetamol quite often as prescribed by your doctor, and you do not get pain relief on that, you could contact our offices and ask for the doctor to prescribe you something stronger. Remember, this is temporary pain relief till we get you into theatre to do the next procedure, which is the radiofrequency. With the radiofrequency, we expect much longer pain relief. So after our radiofrequency, we also give you a script. On the script, there's a very important medication that you need to take. We follow up our radiofrequency with a 6 to 12 week course of anti-inflammatories. The anti-inflammatories is very important due to the fact that it keeps a low-grade inflammation quite down in order for the nerve to benefit from the radiofrequency. If your nerve is in a sour environment or chronic inflammation environment, the rhizotomy do not work that well. So we usually prescribe a very low dose of anti-inflammatory, which is not for pain relief. Some of my patients tell me that they stop the medication because their pain is away. We do not prescribe that for pain. That is to make the rhizotomy actually to work or to be more effective. What we do prescribe additionally is paracetamol or napamol, which you need to take quite often if you get breakthrough pain episodes. We explain to our patients before they go to theatre what to expect of their pain pathways after theatre. And the first stepwise approach is to start with your paracetamol. If you do not have adequate pain relief with your paracetamol, you can contact our offices and we as pain practitioners will recommend something stronger. We will go with a stepwise approach. We either add an anti-inflammatory or we will add a non-opioid analgesia. Remember again, this is short-term analgesia. There is a space for short-term analgesia. Only in the long term, we start looking at serious side effects. If you take a high dose of anti-inflammatory for a long time, you could experience some side effects like gastric ulcer, chronic reflux. You can also experience some kidney damage. I have a lot of patients that's been using Voltaren or diclofenac or similar anti-inflammatories for long periods of time, which is really very dangerous to their kidneys. Even Brufen. So by the time that we get our patients, they've actually been using anti-inflammatories for a long while. So there might be some of these things that's already going on, and we need to tailor-make our post-op prescriptions according to every patient's needs.